Feline infectious peritonitis, FIP, is a viral infection in cats caused by specific strains of the feline coronavirus. There are many different strains of feline coronavirus, which differ in their ability to cause FIP. The various strains are classified as either feline enteric coronavirus, FECV, or feline infectious peritonitis, FIP. Most strains of the feline coronavirus are found in the gastrointestinal tract and do not cause significant disease. Those are the FECVs. Cats infected with FECV are often without symptoms. Others may experience spells of diarrhea and/or mild upper respiratory symptoms, from which they spontaneously recover. Feline infectious peritonitis virus FIP occurs in two forms: wet or effusive form and dry or non-effusive form. In the wet form, fluid accumulates in body cavities such as the abdomen or the chest, leading to a swollen abdomen or difficulty breathing. The dry form affects the central nervous system. It often causes severe inflammation in one or more organs, including the eyes, brain, liver, or the intestines, resulting in clinical symptoms. Once the cat develops clinical symptoms to FIP, the disease is usually progressive and is often fatal without medical intervention. Currently, there are no tests available that can distinguish between the enteric virus and the FIP-causing strains. A positive result means the cat has had prior exposure to coronavirus, but not necessarily to the FIP virus. Up to 50% of cats in single-cat households and between 80 to 90% of cats in multi-cat environments become infected with one or more strains of feline coronavirus at some point in their lives. Incidence of FIP disease is low, affecting only 5 to 10% of infected cats, with less than 1% of cats admitted for veterinary intervention. Kittens are at greater risk of developing FIP, with 70% of cases diagnosed in cats less than 1.5 years old, and 50% of cases occurring in kittens less than 7 months old. The most common mode of transmitting FECV is believed to be via an infected queen to her kittens. It can also be passed from one cat to another via their fecal matter. Signs of FIP disease include lethargy, loss of appetite, weight loss, mild upper respiratory symptoms such as sneezing, watery eyes, nasal discharge, and mild gastrointestinal symptoms such as vomiting and diarrhea. Most cats exposed to feline coronavirus, even the potentially FIP-inducing strains, can develop a protective immune response, resulting in only a small proportion of infected cats developing the clinical disease. The only way to prevent FIP in cats is to prevent FECV infection, which is a difficult challenge.